Good afternoon. In today's video demonstration, I will going to demonstrate the routine procedures of the shoulder, namely the AP projection of the shoulder, specifically the external, neutral, and internal rotation of the shoulder. Then, the last procedure is the uh, AP oblique or Grashi method of the shoulder. Good afternoon, ma'am.
Afternoon, sir.
Please sit down po. By the way, ma'am, I am Jonah Pulgo Ikoy and I am your tech for today. And mga tanong ko ma'am sa imong language preference po.
Bisaya, sir.
Noted po, ma'am. Ma'am, mga tanong ko ma'am po, unsa imong middle name, date of birth, and age, ma'am, kay para lang isa ma-confirm na ko ma'am kung tama ba dyan akong patient.
Wait, sir. Ano po? Pulgo. Then, 17 years old pa po ko. Then, August 3, 2003 po. Birthday na.
Noted po, ma'am. Ma'am, mga tanong ko ma'am kung pregnant ba karon or buntis ba karon?
Dili, sir.
Kanas ay mong last menstrual or kanas ka last gidugo, ma'am?
Last month lang po, sir.
Noted po, ma'am. Ma'am, ngano ganing magpa-x-ray ka, ma'am?
Sa akong left shoulder, sir, kay narisa siya, sir. Kung nagdula may balibol po.
Then, malihok pa niyo yung shoulder, ma'am. Karon,
Ah,
ipakitaas daw ko gamay, ma'am, ana lang, kung makaya pa.
ah,
O, ana. Inaani, ma'am. Okay. So, malihok nimo siya, ma'am, pero sakit siya gamay.
okay.
Pero matolerate lang nimo.
Okay.
Okay, noted, ma'am. Then, bago tayo mag-proceed sa atong procedure, ma'am, is tanggalin na to tanan natong mga metallic objects like quintas or niagi ba kag surgery, ma'am, na kanang gilisdan imong gibutangan og screw imong mga shoulder para manote na ko daan, ma'am.
Wala po.
Wala ko, sige, noted. Then, nadto ato ang dressing room, ma'am. So, mag-change ka og patient gown, ma'am, ha.
Okay.
Then, ang pagsuot sa patient gown, ma'am, is nasa likod ang paghikot or pagtali. So, again, ma'am, sabon ako, ang pagsuot sa patient gown is nasa likod ang pagtali. Nakuha ni mo, ma'am?
Opo.
Sige, noted po. Then, mag-introduce po, ma'am, kani, ma'am, mo na siya ginatawag na thyroid shield. Ibutan natin sa atong liog para maprotektahan atong thyroid sa radiation. Kani, ma'am, mo ni siya atong gonadal shield. Ibutang natin diri, ma'am. Then, mo ni maprotekta sa imong ovaries, ma'am. Kaya ang ovaries, ma'am, o kaning thyroid na to is sensitive na siya sa radiation. So, nakuha ba niyo, ma'am?
Yes,
So,
sir.
tawaran ta kadana ni ma'am.
Opo.
Okay lang man, ma'am, no?
Opo.
Magunit ko. Then, ayha ka magkuhan, ma'am, ha? Dito sa dressing room, ma'am, mag-change of patient gown.
Opo.
Kanin sa, dili ni sa gonads, ibutang, ma'am, ha?
Opo.
Ready na ba ka, ma'am?
Yes po, sir.
Sige, ma'am. Sulod na ta, ma'am. Then, ma'am, atubang ko diri sa ako, ma'am. Then, dikit jud dira, ma'am. Ayan na. Then, today, we're going to demonstrate first the AP projection of the shoulder. Specifically, the external, neutral, and internal rotation of the shoulder. So, in patient positioning, position the patient upright or supine. So, as you can see, our patient is in an upright position. Then, in part positioning, center a point of 1 inch or 2.5 centimeter inferior to the coracoid process to the IR. So, to locate our coracoid process, ma'am, touch ko, ma'am, ha? Dili sakit, ma'am, okay lang.
Okay.
So, this is our coracoid process. So, center the 1 inch or 2.5 centimeter inferior to the coracoid process. So, i-center na to siya sa IR. This is ma'am. Okay, naka-center na atong IR and the coracoid process. So, adjust the hand in external rotation. So, external rotation, the humeral epicondyle are parallel to the IR. So, ma'am, sunduga ko, ma'am, ha? Anyang kamot, ma'am. Okay. So, if naka external rotation ng atong patient, ang atong timahilan is nakasupinit ang hand. Then, ang epicondyles is, ang humeral epicondyles are parallel to the IR. As you can see, parallel siya sa atong IR. Then, for neutral position of the, for neutral rotation, I mean, is, ma'am, rotate ko sa imong hand, anak ma'am. So, ano siya ang neutral position, which is, the epicondyles is about 45 degrees to the IR. As you can see, that the epicondyles is 45 degrees to the IR. Then, for internal rotation, the epicondyles is perpendicular to the IR depending on the departmental protocol. So, ma'am, i-ana imong kamot, ma'am. Sundugan ko kamot. Ana. Dikit diri, ma'am. Ana. So, nakain-ani ang position wherein the humeral epicondyles are perpendicular to the IR depending on the department protocol. So, first is i-exercise na to using the external rotation. So, ma'am, balik og ana imong kamot, ma'am. So, for external rotation, ana siya. Then, the cassette that we were going to, the technical factors for this is 10 by 12 inches atong gamiton na IR, and the SID would be 40 inches or 102 centimeter. So the central ray will be directed perpendicular to the 1 inch or 2.5 centimeter inferior to the coracoid process. So, ano siya? So, the coracoid palpate. So, the coracoid, ma'am, touch ko ma'am. Coracoid process is here. So, the central ray must be centered here. And then, make sure that in collimation, adjust 10 by 12 inches or 24 by 30 centimeter, then place side marker into the collimated exposure field. So, collimated exposure field. Ganyan. So, make sure, assuming that naka-tightly collimated na siya. Then, use compensating filter or to improve the image quality of the one. So, natagibutang dapat din na moon shape siya na filter. So, assuming that we've already put the compensating filter, then shoot. So, for the next neutral rotation of the patient, so ma'am, sunduga ko ma'am, ana ang kamot ma'am. Ana na. Sige. So, for neutral rotation, you can see that the epicondyles are about 45 degrees to the IR. So, as you can see, 45 degrees na siya. So, usually, ang neutral rotation is used for patients nga naay trauma. So, since ang patient trauma man daw siya, and makaya po niya og rotate daw, so pwede rin niya ma-perform lahat. So, same ang central ray directed to the coracoid process, inferior coracoid process. Then, collimation, same again. Then, instruct the patient to suspend the respiration. Suspend, inhale, exhale, inhale, hold your breath, then do not move, ma'am, then shoot. Next one is the internal rotation. So, ma'am, sunduga akong kuan, ma'am. So, from ani, ma'am, no, iaan natin yung kamot. Anak, ma'am. So, for internal rotation, the epicondyles is perpendicular to the IR. So, as you can see, the epicondyles here are perpendicular to the IR. Then, the central ray is same sila, directed inferior to the coracoid process. Then, place the collimate or adjust the 10 by 12 inches to 24 by 30 centimeter. Place side marker in the collimated exposure field, as you can see. Then, instruct the patient to suspend his breathing, her breathing. Then, ayaw lihok, ma'am. Hold your breath. Then, shoot. For external rotation of the AP projection of the shoulder, The anatomy demonstrated are the following. Clavicle is here, the acromion process, the coracoid process, the scapulohumeral joint, then the scapula here, then the humerus. For the criteria evaluation for AP shoulder projection, the scapular body demonstrates the minimal transverse foreshortening, and one half of the scapular body is visualized without the thorax superimposition, as you can see here. Then the clavicle is demonstrated with the minimal longitudinal foreshortening and with the medial clavicular and position to the next to the lateral edge of the vertebral column, as you can see on the clavicle. Then, for non-dislocated shoulder, the glenoid cavity is partially demonstrated with the humeral head superimposing it. And for dislocated shoulder, the glenoid cavity is partially demonstrated with humeral head position inferior to the glenoid cavity. And for the externally rotated humerus, as you can see that the greater tubercle is seen, kaning arrow, the greater tubercle is seen in profile laterally, in the humeral head in profile medially, as you can see. So medially mo na siya tong lesser tubercle and greater tubercle. Then for neutral rotation, as you can see, the clavicle are shown here, the acromion process, the coracoid process, the scapulohumeral joint, the scapula, the humerus are clearly demonstrated, and the lesser and the greater tubercle. So, in criteria evaluation for AP shoulder neutral rotation, the greater tubercle is partially seen in profile laterally, and the humeral head is partially seen in profile medially, as you can see here. So the greater tubercle is partially seen in profile laterally. And for the structure shown for internal rotation of the shoulder are the same with the neutral and the external rotation. However, they differ on the location of the greater tubercle and the lesser tubercle. And for internal rotation of the shoulder, the lesser tubercle is seen in profile medially, as you can see here. Then the greater tubercle, the humeral head is superimposed by the greater tubercle. As you can see, nag-superimpose ang greater tubercle and the humeral head. Then, and so over, including the internal and external and neutral, and superior scapular body is at the center of the exposure field, as you can see here. And the humeral joint, clavicle, proximal third of the humerus, and superior scapula are included within the exposure field. The next procedure that we're going to demonstrate is the AP oblique or de Grashing method. So, position the patient, in patient positioning, position the patient upright. As you can see, then same technical factors atong gamiton parehas sa katong AP projection sa shoulder. Then in part positioning, center the eye arc the scapulohumeral joint, which is the joint is 2 inches or 5 centimeter medial and 2 inches or 5 centimeter inferior to the superolateral border of the shoulder. So, center na to siya. So, ma'am, tagilid ta, ma'am. Rotate the body 35 to 45 degrees toward the affected side, since left man. So, ma'am, anak ma'am. Then, the greater the rotation may be needed to place the plane of the scapular body parallel to the IR if the patient is recumbent. Since patient naka-upright man, nani siya, naka 35 to 45 degrees ang yung rotation. Then abduct the arm slightly with palm on the hand on the abdomen. So ma'am, sinduga ko ma'am, ang kamot ma'am. Anak, ma'am. Anak. So, okay na ma'am, dili sakit ma'am. Sige. So, the central ray must be perpendicular to the IR. So, here, dito gyapon ta magkuha sa the central ray must be centered sa coracoid process. Dili. Ana. So, collimate. For collimation, adjust the collimation for 8 to 10 inches or 24 to 30 centimeter. Then place side marker in the collimated exposure. So, since left man siya. Okay. And make sure that the lead marker is do not superimpose with the anatomy demonstrated. Then, instruct the patient to suspend his breathing. Then, the SID that we'll be using is 40 inches or 102 centimeter. Ma'am, I inhale, exhale, inhale, and hold your breath. Then do not move, ma'am. Then shoot.
3.
In the structure shown for AP oblique projection or Grashy method, as you can see, the acromion are clearly demonstrated. The humeral head, the glenoid cavity, the clavicle are clearly demonstrated with that AP oblique projection or Grashy method. So, in critical evaluation, in criteria evaluation for AP oblique projection, the glenoid cavity is demonstrated in profile and the glomerular joint space is open. As you can see here, this is the glomerular joint. Then naka-open siya. Then the tip of the coracoid process is superimposing the humeral head of the head by about 0.25 inch or 0.6. So as you can see, superimpose sila. Then, the clavicle is longitudinally foreshortened and is horizontal situated. As you can see here, the clavicle here. Eto. Then, the superior margin of the coracoid process is aligned with the superior margin of the glenoid cavity. As you can see on the radiograph. The glenoid cavity, humeral head, coracoid, and acromion process, and the lateral clavicle are included within the exposure field. Ma'am, done na po atong procedure, ma'am. And salamat kayo, ma'am, sa kami na og tarong sa akong instruction. And by the way, ma'am, ang result, ma'am, is 2 to 3 hours pa po siya bago makuha, ma'am.
Opo.
Okay lang ba, ma'am?
Okay lang, sir.
Thank you po, ma'am.
Thank you, sir.